an arrhythmia. This is something very common. So you've got an irregular heartbeat. Or if it's brand new, get it checked out by a doctor. Arrhythmias get missed a lot because they don't always happen all the time. They often happen once in a blue moon, and it's not when you're at the doctor's. Very, very serious condition. It can lead to a stroke, a blood clot, all these problems, which is why I put my disclaimer up there and why it is serious. I have plenty of patients who are like, I have an irregular heartbeat and I'm not going to see a chiropractor, and what homeopathy do you have for me? Well, I have homeopathy. If you're not going to see the doctor other than me, then I'm just going to give it to you and cross my fingers, because we can't swear by them. But I can say that Corocalm, it's the right in the middle, is a homeopathy from Germany, and it actually really helps to reset atrial fibrillation and calm that arrhythmia down. It is, you can use it daily, but there's nothing better than sometimes getting an ablation or taking a medication to keep that consistent. I have plenty of patients who have atrial fibrillation who are on medication, and they still have a little flutter here, a little flutter there. And Corocalm is a great rescue remedy. I mean, nobody likes to have that flutter because it's always concerning. So Corocalm can be a great remedy for that. Take more of it the longer it's been going on. The more the sensation you can feel, the more you can feel it in your ear, the more you want to take. 20 to 30 drops is about average per episode. Any kind of lifestyle like hypertension, HTN is hypertension, your paleo to primal anti-inflammatory diet is very important for an arrhythmia. Keeping those blood vessels as healthy as possible, giving the B vitamins and the fish oils to keep the elasticity, to help repair the damage that's there and kick out toxins, really important for an arrhythmia. That part is really just fixing part of the irregular heartbeat. An irregular heartbeat sends out a stressful message to the body. The B vitamins and fish oil help to calm that down. Berberine is an ingredient that can help diabetes. It can help lower cholesterol. It lowers inflammation, and it helps with blood sugar regulation. So not just diabetes, those people with high insulin or blood sugar irregularity. Berberine has been studied to be very beneficial to the cardiovascular system after somebody's had an ablation, and very healing to the tissue in the heart after an ablation. Twice a day use, and then we've got our concoction of fish oil, methylated B vitamins, CoQ10. They help keep the blood slick. When you have a heart issue, you don't want your blood to be thick like castor oil, and you don't want it to be sticky like honey and syrup. You want it to be nice and slick. And so your B vitamins, low sugar diet, low carb diet, fish oil, and CoQ10 help that. Vitamin C and vitamin E are antioxidants, and there have been studies that have shown that both of those can be very beneficial at the healing after the body's response of an arrhythmia. Acupuncture has been known to stop arrhythmias. Yoga, self-hypnosis, biofeedback, those can help people who get arrhythmias when they start to get anxious. Especially if it's like, oh gosh, there's a dog across the street and it's a Rottweiler. A lot of biofeedback can help calm that anxious tone down, because that triggers the adrenal glands to release epinephrine and norepinephrine, which contributes to an increased heart. Some of us, if we get an increased heart rate, get an arrhythmia almost immediately. So that's where biofeedback and cognitive behavioral therapy can help to retrain that brain. Enlarged prostate. So this is only for half you guys out there. Well, maybe a quarter of you. Paleo diet is super important. Exercise is tolerated, whatever you can do. And meditation, spirituality, and stress management. No, I'm not saying if you go in the corner and pray to God and meditate for an hour that your prostate is going to shrink. But I am going to say that if you meditate, or if you're a spiritual person and you reach out to your spiritual person, God, he or she, whatever that may be, Islam, it doesn't matter. When you take a moment to give yourself peace and let everything reset, then you can get a huge benefit at stress reduction. And the feedback of stress reduction reduces the prostate. A super stressful lifestyle a stressful job, commuting all the time because of stress, makes the prostate worse. And gentlemen with large prostates who have like big business jobs and work in oil industries and stuff like that tend to have more problems with the prostate and need more surgeries because of their high stress jobs. When they're retired, they tend to have less problems with their prostate because they're not running businesses. So prostate can be a reason to go see the doctor. Men have swollen prostates. It's usually not a problem, but sometimes it swells and you can not pee. That's an emergency. And sometimes it's swollen because there's something wrong with the prostate. That should always be evaluated. Potentially avoid red wine, ginger, alcohol, blue and aged cheeses, citrus, tyramine, which is an amino acid. So people who go super keto may not be the right lifestyle for somebody with an enlarged prostate. Keto for a month to lose weight or remediate some inflammation may be okay, but a long consistent diet of being in ketosis is not usually the best idea. Your cherries, plums, pineapples, aged meats, and a high protein diet. And it's different for everybody. I've got patients who, they have an enlarged prostate and they drink tart cherry juice because they've also got gout. The tart cherry juice doesn't bother their prostate. But if they stop drinking the tart cherry juice, they've got a gout flare. So it's always finding, okay, what's the risk, what's the benefit, and the balance. For some of you, it may just be the wine from Tolosa, or maybe the wine from that new shop in Arroyo Grande, and not the wine from Tally. You know, it just depends on the tannin amount, if it's organic, and other factors. So decongestants, antihistamines, MAOI inhibitors, and sodas can exacerbate and make these symptoms worse. MAOI inhibitors, I just put a note up there, are often used in Parkinson's and severe hard to treat depression. So they're not commonly given anymore because they've got a lot of side effects. But there are plenty of people who are on them because they've been on them forever. And at a certain point, doctors don't take people off of medication and change them to the newer medicines, because if it works and you're okay, they probably don't want to throw you onto something that they don't know if it's going to work for you. These are our main treatments for prostate, if you will. And they're used in higher doses for prostate cancer. So treatment for prostate enlargement and prostate cancer are very similar. You've got your Prosta Response. That is a specific name brand, and that is 3 pills at night. We take it at night. Well, the gentlemen take it at night, so they're not going pee all night. It's the worst problem with the prostate. Green tea extract, nice antioxidant, 1,000 milligrams twice a day. Reactivated zinc is only 50 milligrams a day, and that helps with the testosterone and the conversion of testosterone. So it's really helping it by a backdoor method, basically. Selenium, same thing, helps with hormone conversion and works kind of by the back door to help decrease the prostate swelling. Pomegranate, vitamin E, tocopherol in the morning, and tocotrienol at night. So this is when the vitamin E gets split up between the two. So you don't want to use a mixed tocopherol. You actually split them up and do one in the morning and one at night. Especially with cancer, because you want that vitamin E as an antioxidant to get rid of all of the cancer stuff. And melatonin, so smaller doses for just an enlarged prostate, and larger doses if it's prostate cancer. So thyroid issues, kind of put this towards the end. Paleo to grain-free diet. I must say that a grain-free diet has behooved the majority of patients who are on thyroid medication or have a thyroid issue. Wheat tends to be the most offensive agent. This is not true in everybody though, almost everybody. An anti-inflammatory diet can be in order. There are plenty of people who, go on an autoimmune protocol, people who stick strictly to their food sensitivities and food allergies, and we've got people who get very serious about their diet with the thyroid. When you find the diet that works for you, stick with it. You know, for some of you, you were born in the Mediterranean and that's where your genes came from. And so a Scandinavian type diet may not be the best one. You may be mostly Scandinavian. And so a Mediterranean diet may not actually be the right diet. And so looking at that in that direction through those lenses can be very helpful too. And what I mean by that is, like, you know, wheat is pretty bad in most people with thyroid issues. I'm Scandinavian. When I eat olive oil, my thyroid is off. And when I eat olive oil, my cholesterol is horrible. I switched over to grapeseed, which is what you get in Scandinavia, and those things improve dramatically. Still trying to not eat wheat, but I have a kid at home, that's my excuse, and a chef for a husband, that's my excuse. I'm sticking with it. In any event, though, there's plenty of people, like, if you're Asian, you probably don't really want a Mediterranean diet because that might not be the right diet for your ancestral genes to get as an anti-inflammatory. Does that make sense? Exercise your whole body, head to toe. Whatever exercise you'll do, move the whole body as often as you can. There's a lot of sluggishness in hypothyroidism and a lot of arthritis and a lot of stagnation. And the only way to get things moving is to literally move your body as much as possible. We often need the muscles to squeeze, to move the lymph and move the hormones and all this other stuff. Selenium is a main standby for most people, whether you're hyper or hypothyroid, because that helps with conversion of hormone. Iodine is controversial, and what I mean by that is here on the Central Coast, everything was under the ground, so there's iodine in most of our food, and if people are eating locally at the farmers markets, they're typically getting plenty of iodine. If you're from Arkansas or you're from, you know, Kansas, you've got a pretty good argument to use some iodine. But what the doctor and I have noticed is that for most people, when they start tinkering with iodine, it tends to either throw them hyperthyroid or throw them hypothyroid. But we do carry a little bit of iodine because some people swear by it, and we use 6.25 milligrams on a daily basis. It's not something that I would start with. If you think you have a thyroid issue, start with selenium. Start with selenium, especially if you're a native Californian. Treat your hypothyroidism. That can mess up your cholesterol. That can cause high blood pressure. That can cause arthritis. And that can just mess up your cholesterol levels big time. Bad cholesterol, hard cholesterol causes inflammation, which leads to cardiovascular disease. We in the office have Nature Thyroid, which is a pork-driven thyroid. It is a prescription, but I put it in here because it's more natural than something synthetic with chemicals made in a lab. And it has the hormones T4 and T3 in a balance that's supposed to mimic a human. It works for many people. It doesn't work for everybody. There are risks with every medication, but it's a choice for people who want more of a natural approach to thyroid. No such thing for the hyperthyroid folks. I wish there was. It's just prescription. Sorry, guys. Osteoporosis. So this actually didn't show up on any of the recommendations, but I know that it is an issue near and dear to my heart, and I figured there'd be women in here who probably have a similar issue. Compared to some of the other things we were talking about, this doesn't need to be monitored as closely, but should be looked at so that you know, is this expensive supplement working or not? So back in the day, we used to tell everybody, pardon me, get on calcium, 1,200 milligrams every day, and people were having heart attacks. So we realized that calcium wasn't the key for osteoporosis. It's mineral balance, magnesium and calcium. And so when we look at patients who have osteoporosis, we're also looking at plaque markers and inflammation of the blood vessel, because if their treatment is causing cardiovascular disease, we have to drastically treat that. So that this doesn't happen to everybody. I'm just very concerned about this. A paleo diet, non-inflammatory diet, too much inflammation of the body thins the bones. Low glycemic and low sugar, super important for strong bones. Weight-bearing exercise, at least 30 to 60 minutes a day. And that's using your core, using your leg muscles, And don't forget about your wrists. And it may be something like taking a can of tomatoes and you're just using it in different directions to build that up. Your wrists are what catch you. When we fall forward, we are likely to crack our wrists. The cracking of the wrist isn't what's going to keep you in the hospital for months. That's going to be your femur. And most doctors' offices won't check your wrists for osteoporosis.
What ratio are you recommending for magnesium calcium?
What?
What ratio are you recommending?
Two of the magnesium to 1 of calcium usually. Yeah. Did you have a question? Oh, just making sure. Anybody else? So K-Force is a vitamin D with a K2M7, and the K2 is super important because that is what gets the calcium and magnesium into your bones where it belongs, not sticking in your blood vessels. So K-Force helps cardiovascular disease, prevents plaque, and strengthens your bones. That's great for women. Rebuild is usually what we pick when you actually have osteoporosis, and some people it's 2 pills a day. Some people it's 4. I've got some people on 6. It's to be taken with food, so it's easier digested and gets into the system easier. And we follow labs to make sure that that's working. There's a urine test that we can do to see if people are having bone breakdown. I actually like AlgaCal. I've had several women who Rebuild was not working and some of the other things we had in the office was not working. But working at an endocrinologist office, I have found that AlgaCal works really well. And most people only need 2 pills a day for that. And you just get it online, algacal.com. Something I learned from my patients. Strontium can be something additional. You think of it as making things stronger. And it's usually about 400 to 600 milligrams daily that we add in. It's not our first go-to because we want to make sure that the minerals are getting into the system. There are people who have weight-bearing exercise. There are people who have weight machines where you're using against your resistance or a little bit of weight. There's physical therapy. There's groups that have weight-bearing exercise for osteoporosis. Sometimes even physical therapy for balance training can help build bone. And that's it. Yay. Just in time. If you're supposed to stay away from iodine, I think that the AlgaCal doesn't have enough to affect it because they've taken it out. But it should be safe enough, yeah. Any other?
Does one have to be a patient at your office or to buy supplements?
No, you don't have to be a patient in our office to buy supplements. Our supplement shop is free to, or open to the public. Not free, sorry, just kidding. Huh?
Business cards.
Oh, and there's business cards out front with our address if anybody would like that.
You might want to say that on that. If they're over a certain age, they get a discount.
Oh, we have a wisdom discount at our office. So if you're over a certain age and you're really wise, you get 10% off every single day.